Hi there. Welcome to the overview of your medical scheme benefits for 2025, brought to you by NMG Benefits. This video highlights and summarizes the various options available on Umvuzo. NMG is an authorized financial services provider. NMG staff are fully accredited with the FSCA, the Council for Medical Schemes, and your medical aid. As one of the largest financial services intermediaries in South Africa, with more than 30 years of experience, we can assist with various elements of your medical scheme and provide you with independent advice on the most appropriate option. In this presentation, we are going to take you through the three main components of your medical aid, provide you with an option summary, and lastly, look at the monthly contributions for 2025. Let's move on to the overview of the three components of your medical scheme: hospital cover, chronic cover, and day-to-day cover. Hospital cover is the most important element of your medical scheme. Hospitalization is unlimited on all Umvuzo health options. The Extreme Plan reimburses hospital claims up to 150% of the Umvuzo scheme rate. The Supreme Plan reimburses hospital claims up to 125% of the Umvuzo scheme rate. And all other plans reimburse hospital claims at 100% of the Umvuzo scheme rate. Planned hospital procedures need to be pre-authorized with Umvuzo by contacting the number on your membership card. Your doctor may do this on your behalf or may give you the necessary codes and descriptions to obtain the authorization yourself. Umvuzo members can use any hospital of their choice for both emergency and planned procedures, regardless of their chosen plan. In the case of an emergency event, members must go straight to the closest hospital. It is recommended that members always carry their membership cards with them. It is becoming more important each year to consider taking out gap cover. Gap cover is a short-term insurance product which can be purchased separately from your medical scheme and is an effective way to ensure that you are covered for hospital shortfalls. These shortfalls arise because there is no forced regulation on provider charges. Medical schemes may only cover up to a certain rand value, or your medical scheme has co-payments and deductibles. Gap cover will assist in covering the resultant in-hospital shortfalls. Please contact your NMG consultant to discuss the gap cover options available to you. Let's move on to your chronic cover. All plans cover for medication relating to 27 chronic conditions which are paid from risk. Certain plans have an additional list of chronic conditions that will be covered, so it is important to understand this before you consider a plan change. A plan downgrade will result in the member having to pay for this medication from day-to-day benefits instead of the chronic benefit. Should your doctor diagnose you with one of these chronic conditions, they will need to complete a chronic application form and submit this to your medical scheme. This will ensure that your treatment and medication relating to the condition is covered by the scheme and will not affect your day-to-day benefits. Each plan has a chronic medication list, known as a formulary list, to guide members on which medications are available on their plan. If you choose a medication that is not on the formulary, a co-payment will apply. Chat to your doctor about the possibility of changing to a formulary medicine to avoid this shortfall. All members are required to make use of a designated service provider to avoid a co-payment on chronic medication. Umvuzo members also have access to preventative care benefits which entitles you to a number of screenings, preventative tests, and vaccines. Let's discuss day-to-day benefits. Umvuzo offers a variety of traditional options to meet members' different needs, where the options provide baskets of benefits with limits for the various types of out-of-hospital treatments. The Activator option offers rich day-to-day benefits for primary healthcare needs such as GP visits, medication, optometry, dental care prevention, and screening benefits. This plan also offers members a Healthy Me program, which through a genetic test identifies health and lifestyle risks and guides them to lead healthier lifestyles. The affordable range is specifically designed for younger members who embrace technology and innovation to improve access to healthcare. The plans in this category offer standalone day-to-day benefits as well as GP benefits accessed through Umvuzo's digital platform. For further medical interventions that may be required, the member will be referred to appropriate specialists. The standard option is a comprehensive option with generous benefits on all levels to suit the healthcare needs of the entire family. The Supreme option is a traditional fee-for-service option which offers members freedom to choose any provider of choice for their everyday needs. Umvuzo Maternity Care Program is available on all plans and includes the following benefits: ultrasound scans and radiology screening, GP and specialist antenatal consultations, antenatal vitamin supplements for the duration of the pregnancy, pathology and blood tests, a follow-up visit with a pediatrician provided baby is registered within 30 days after birth, and a gynecologist consultation for the mother within 6 weeks of delivery. Now that you have a better understanding of the key components of your medical scheme, let's take a closer look at the options available. The Extreme option reimburses hospital claims at 150% of the Umvuzo health rate, while the Supreme option reimburses hospital claims at 125% of the Umvuzo health rate at any hospital of your choice. Both plans offer members an additional disease list of 9 chronic conditions where medications, once registered, will be paid from the risk benefit. The day-to-day benefits are more traditional in nature, with baskets of benefits with limits for the various types of out-of-hospital treatment. The Activator option reimburses hospital claims at 100% of the Umvuzo health rate, with chronic condition coverage for prescribed minimum benefits of 27 chronic conditions. The plan also offers rich day-to-day benefits with limits, and members have access to the Healthy Me program for additional primary healthcare benefits. The standard option reimburses hospital claims at 100% of the Umvuzo health scheme rate at any hospital of your choice. It also has chronic condition coverage for prescribed minimum benefits of 27 chronic conditions. The plan also offers a rich basket of day-to-day benefits with limits. The ultra-affordable and ultra-affordable value options reimburse hospital claims at 100% of the Umvuzo health scheme rate at any hospital of your choice. At the primary level, members have access to healthcare services through a combination of virtual and face-to-face consultations with primary healthcare providers. For further medical interventions that may be required, the primary healthcare provider or GP will refer the member to the appropriate specialist. Members on the ultra-affordable value option access primary care such as GPs and nurses through the Umvuzo digital platform. This app-based virtual consultation platform allows members to consult healthcare providers in the comfort of their homes or places of work. Only through the Umvuzo digital platform can the members be referred for in-person GP consultations when required. For further medical interventions that may be required, the primary healthcare provider will refer the member to the appropriate specialist. These primary benefits are further topped by secondary and tertiary benefits for full healthcare coverage. Let's take a look at the 2025 contributions. Note, the ultra-affordable and ultra-affordable value options are income-banded plans. This means your contribution will be based on your gross monthly salary. Although we make every effort to get things right, there may be times when you feel that you have not received the level of service you are entitled to. The complaints procedure can be downloaded from www.nmg.co.za. Please reach out to your NMG consultant if you need any assistance with your plan choice.